NUNAVUT has suffered more than 50 child suicides since 1999. In NUNAVUT, suicides among children under the age of 15 make up 11% of the total suicides, compared to 1% in the rest of Canada. This past spring, the Centers for Disease Control and Prevention in the United States released data over the past 15 years on suicide, showing an increasing upward trend in the United States. Notably, deaths due to homicide have decreased significantly. There are on average 13 suicide deaths per 100,000 in the US. The rate is higher in Alaska at 22 per 100,000 and highest among young Alaska Native boys and men between the ages of 10 and 24 at 107 per 100,000. And you can see the same kind of regional variation across the Arctic, with higher rates occurring largely among indigenous groups in the north, particularly in North America, Greenland, and Russia, as evidenced by the red, which is North America, the green, which is Greenland, and the blue, which is Russia and its regions. So what causes suicide?
The causes of suicide are complex, but we know that an upbringing affected by alcoholism and abuse increase the risk of suicide. In Greenland, many have experienced suicide at close hand, either among family or friends. My interest in politics started when I was a young schoolgirl in my hometown, DORIS. Back then, there were many suicides. I became a member of the student council at my school, where I succeeded in establishing counseling for children and young people who had problems.
The most effective programs and initiatives are locally introduced, culturally appropriate, and are based on Inuit societal values. This is why the government of Nunavut fully supports traditional ways of learning and backs proven community-based initiatives. Community members know what their communities need. Reinforcing positive mental health and well-being also requires us to acknowledge and address some of the highest levels of poverty, homelessness, food insecurity in the country. Building healthy relationships with each other and with each level of government is just one interlocking component as we work together to reduce family violence in our communities and empower everyone for generations to come.
There need to be policy interventions. There will need to be some interventions at the level of the health system, some will be clinic-based, others will be at the level of the community, and some at the level of the individual. And the goal is to look at all of these as they're relevant. Our communities are our mental wealth, and I think this is perhaps the most valuable resource of the Arctic, and so it merits priority to address it and to protect and to promote the mental health of communities.
Healthy, supported communities continue to be our greatest source of strength and resiliency. We must collectively strive to support gender equality in our families, our communities, and our workplace. Every day, people come together to lead the growth and develop our communities. Our children and our youth will be leaders and curators of tomorrow, and many of them already are. That is why it is so important that programming is made available to provide guidance and support from which NUNAVUT can grow, prosper, and ultimately heal. Merci. Thank you.